warm welcome and thank you so much for tuning in. Our top focus. Now, the national capital has reported over 2,400 fresh cases of COVID-19 in the last 24 hours. Remember, this is the highest tally over the course of the last 6 months. Now, also pertinent to note here that this is in fact the third consecutive day that the national capital has reported over 2,000 cases. 2 people, remember, have succumbed to the virus in the last 24 hours. The positivity rate in the last 24 hours was at 12.95%. That is almost nearing the 13% mark. It has remained above 10% for the 5th day in a row now, and Delhi currently has over 6,800 active cases of COVID-19. As many as 4,046 COVID patients are in home isolation. Meanwhile, India has reported 19,928 fresh COVID cases in a day. All right, on this very note, in order to share more perspective on the story that concerns all of us right now, I'm being joined by Dr. Suneela Garg, member of the Lancet Commission and advisor for the ICMR Task Force, Dr. Ishwar Gilada, Secretary General, Organized Medicine Academic Guild, and in fact, this is a call-in show, so please do make a call to Mirror now if you have any concerns or any questions over this current trend that is being witnessed in the national capital, where the COVID cases are surging by the day. In fact, I would like to go across to Dr. Suneela Garg here. Ma'am, my first question to you, what according to you is contributing to this massive, worrisome spike in the national capital? Do you think it's somewhere owing to the laxity of the people, that they're not going out, not getting their booster shots? Do you think somewhere this whole attitude of, like chalta hai when it comes to the booster doses actually leading to this massive spike of COVID cases in the national capital?
First of all, thank you, Pooja, for having me on the show. And let me tell you that we are watching this COVID situation very closely across the country. And it's, and we had always been maintaining that COVID has not gone out of our country. Gradually we'll see more number of cases, and they will go into the stage of endemicity. But as far as when we are talking of a particular place like Delhi or, other places, one thing which we have to remember is that it is very important and to follow, COVID appropriate behavior. That is number one thing, because, 2 schools just panicked and they, gave orders for, closure as well. And also we have to see that there are precaution doses which are available. And we have got hardly, less than 20% of the people who are, above 18 years of age and who have taken the precautionary dose. So that is one of the important factors also. So together, and over a period of time, the immunity wanes. So that's one thing which we have to keep in mind. And also we have to see wherever we can follow, the COVID appropriate behavior. That is one of the most crucial things which we have to do that. And now there is no shortage of vaccines. The government has made available precautionary doses for all. So that is where we have to see that. And children who have not been immunized for 2 doses also, they must come forward and their parents must ensure that they take at least 2 doses and then they go for their boosters as well.
All right, Dr. Suneela Garg, please stay with us. In fact, I would also like to go across to Mr. Dr. Ishwar Gilada here. So do you think it's time that Delhi brings back COVID restrictions in place, like strict masking, strict social distancing, keeping in mind how it's witnessing a mega surge for the 2nd day in a row now, more than 2,000 cases being reported?
Pooja, thank you very much for having me on the show. I will go from where Dr. Suneela Madam said that we should have COVID appropriate behavior, but where? In public meetings, conferences, programs, in closed halls, in theaters, in public places, in public transport. I think only there and there. Otherwise, people are not going to listen, number one. Number two, you should only don't look at numbers, but you look at trajectory of the infection, what happens after people are infected, how many of them require oxygen, how many of them require bed or ICU or ventilator, how many of them are dying. Now, if you look at cumulatively, India had 1.3% death rate, that is a case fatality rate. And current case fatality rate is 0.1%. So it is much less than what it was earlier. And 0.1% is also a case fatality rate for flu, common flu. So if you are not worried about common flu, why we should be worried about so much of COVID? And COVID has vaccines are cheaper, free of charge. Flu vaccines are very expensive. Despite that, we are not worried about flu, but we are worried about COVID. So whatever vaccination schedule is there, people should take it. We should open up vaccination for children which are above 5. There are a number of vaccines available. I don't know why we are shying away from starting that vaccination. And secondly, wherever possible, restrict kind of gatherings. I'm currently in Canada. We were at a conference in Montreal last week. Not a single person was seen without mask in a whole conference hall. 8,000 people in conference. So I think if that kind of strict behavior is there, and what we should learn is from medical profession. You go to any clinic, any hospital, whether COVID is up or down, people are always masked. So if hospitality industry and hotel industry is masked, why not other people when they are in public, when they are in public transport, trains, buses, in theaters? So I think those are the places, closed places where there are a lot of people. They should be masked, and very much crowded places they should be masked.
All right, Dr. Ishwar Gelada, here I would once again like to go back to Dr. Suneela Garg. Ma'am, we know that vaccination is the only true armor, the only weapon that we have against this deadly virus. And in fact, we've seen how when, vaccination drive was in fact moving smoothly. In fact, even as per studies and reports, the COVID cases had massively gone down. There was actually a mega decrease in terms of the cases that were initially shooting up because there were not enough vaccine supply in the country. What, according to you, are the challenges in terms of, holding a vaccination drive and reaching out to the people, spreading that kind of awareness in a country like India, which has massive population?
I think, Pooja, your question is very right, but challenges are not in terms of, from the program perspective, it is the awareness perspective. We have already got Har Ghar Dastak Abhiyan phase 2, which is already there, under which, healthcare workers or frontline workers are telling people. But somewhere you see, when you see the numbers, which are, as Dr. Gilada also pointed out, we are not seeing serious cases. We are not seeing hospitalizations. We are not seeing many deaths, which come to the notice of a common man. So, shows like this, which you are holding and which reach to the last mile, I think should make a difference in terms of creating awareness that COVID has not gone out of our lives. And the second important responsibilities of the administration, the laxity of the administration is at least wherever, we can manage the crowd, like in metros or in buses or in cinema theaters and all. And where the contact is also for a longer period of time, we can ensure that nobody enters a metro or a bus or, the public vehicle unless they are wearing masks. Because remember that even when, vaccination was there, not there, mask was a very important social vaccine. So somewhere I think, it is again, Government of India has already got a communication strategy to address vaccine hesitancy. And I hope that, over a period of time, we again revive that vaccine hesitancy. And again, this hesitancy knowledge has to go back to reach to the last mile so that people, they are aware of that COVID has not gone out and the vaccination is available. So they must come forward and take the vaccine.
All right, a point well taken. Dr. Ishwar Gelada, what according to you is holding back people in India to actually go out and get their booster doses?
No, you see, there are two things. One is that Organized Medicine Academic Guild has been insisting upon the government for two things. And we are glad that it was done and Government of India listened to us. But they took long time. There were two things what we were insisting on. One was that the gap between second and third dose, which was 9 months, should be reduced to 6 months, so that those people who had not taken second dose, they would take it. And their hesitancy was a relative hesitancy. They were not hesitant to take vaccine because they realized that COVID is not creating any problem. Why to take second dose? Or there was a gap of 8 months, 9 months, but not 6 months. Second demand was that below 60 vaccination, third dose should be free. And it took long time for Government of India to decide that. There were almost 15 crore vaccine were going to expire. And we have been insisting that we are allowing vaccine to expire on one hand. We are not providing free of charge below 60. Now we made people habituated to getting everything free. Once you make habituated to get everything free, and when people are not dying of that disease, they will not spend on that. During the Delta wave, people could have spent 1,000 rupees for a vaccine, but now they will not spend. So, but Government of India have thankfully listened to us, and that even below 60 vaccination is free. Now, third thing is that people which are having a reckless behavior, they should be also aware that they have parents, grandparents at home, and they would bring infection from them, and they would be infected. So currently, whatever 0.1% people are dying, who are dying, those which are above 60, those which are having comorbidities. Sometimes they are above 70, about 80 people are dying. So if you don't want your parents to live, you don't want your grandparents to live, you want to kill them properly. Don't make them infected because they are just bedridden, they are at home, you are out, and your reckless behavior is having infection in them. So I think we should look at these strategies. We should educate people in this manner. We should see that conduit of getting infection from there to here is you, and you have to be responsible. If you are alone, fine, no problem. But if you are having a family at home, then you are responsible for bringing infection from there to here. So I think if we look at these 3-4 things and we allow everything to open up, there is no language of close up, there is no language of any restriction, people are not going to listen. If you want to have any kind of restriction, stop those which are anti-vaxxers. Even today, a lot of times, people on Twitter and social media, they try to hound on me or Madam Suneela ji that we are agents of pharma companies. We are trying to sell vaccine. Why we should do that? We understand science, we have been telling people. But those anti-vaxxers which are doing that, you put them behind bars. And they are the people which are creating problems, not the people who are not taking vaccine. So when there is a relative vaccine hesitancy, when COVID is lying low, any disease is lying low, people will go by way of people, what people are saying. Or people are dying of some cardiac problem, this problem. But to tell you frankly, our Indian vaccine is the best vaccine. I have traveled all over the world. I've seen what is happening elsewhere. Even mRNA vaccine, Pfizer mRNA vaccine, has a potency of only 4 months. Whereas those who have taken our vaccine, which is mainly AstraZeneca or Covaxin, their potency is more than 6 to 8 months. So our vaccine has been proved, and I'm not talking just because I'm an Indian. I have seen a study of, and that study is very famous, from Malaysia. So third-party country. Malaysia had 3 vaccines: AstraZeneca, which is Covishield in India, Pfizer mRNA, and Sinovac from China. And they look at the infections after vaccination and how many of them have died, which is called a breakthrough infection and death from breakthrough infection. What they found, if 1% died of AstraZeneca, 2.5 times more people died of mRNA, and 9.5 times people died from Sinovac. That means our vaccine is the best one, mRNA is the second one, and Sinovac is a useless one. So we should understand one thing, that our vaccine is good. It has not caused any problem. After getting vaccine, you get little bit fever, little bit headache, little bit backache for a day, but for the next 6-8 months, you are free. And even if you get infected, you don't die. So vaccine is guaranteeing 3 things. Number 1, prevention of infection up to 70 to 80%. Number 2, prevention of hospitalization or severe illness up to 95%. And number 3, prevention of death up to 99-98%. So if you get triple benefit from one prick, I think we should take it. And we should stop the anti-vaxxers from creating any. You don't want to take, fine, but you don't try to stop others from taking. And thankfully in India, we don't have a big moment like we don't want to take vaccine. People will take out morcha. But you go to many other countries, including USA or Canada, where they took out big marches that we don't want to be vaccinated, and they create such kind of hysteria in people. So at least thankfully in India, that much is not there. Only there are some few miscreants which go on public media and they talk about something against vaccine, or talk about doctors who are favoring pharma company or something like that, which is not so.
All right. Dr. Ishwar Gilada, point well taken. In fact, here I would like to once again go across to Dr. Suneela Garg. Ma'am, do you think somewhere, with this whole festive season also nearing, do you think fourth wave is inevitable, and this whole trend of actually, seeing a mega COVID spike in every 6 months, it is imminent?
I don't think so. We are looking towards the fourth wave, but it is important still. As you said, that the festivals are approaching, so that's where we are talking about COVID appropriate behavior, and all the more, very, very important to stress upon the fact that go forward and take your booster shots. That is important. And people, there are still, there's a huge chunk of population who has not even taken, the second dose and all that. That I was meeting one day a senior officer just few days back, and she said, no, I have not taken even a single dose, and I'm not wearing mask, I'm protected. So these kind of examples are very derogatory for the population. So it is important that we, kind of focus upon that we have to, protect ourselves, and we have no right, as has been pointed out, to, infect people who have already taken the vaccine, particularly like elderlies or people with comorbidities. So, with the festival coming, if you want to enjoy the festival, you must have the COVID appropriate behavior, take your booster shots. That is the important message from a public health perspective. India has gone to 200 crores plus, and now we should be,
All right.
focusing on the target of 2.5 crore as well.
All right. Thank you so much for your time, Dr. Suneela Garg and Dr. Ishwar Gilada. Thank you for speaking to Mirror Now.
Thank you.
Thank you.